La 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 la. La 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 la.
Hello there. So welcome to Pali's CPD workshop for 2023. My name is Winifred Van Oak, and I hope that you enjoy having this lesson with me. At this point, we are going to look at evaluating patient outcome and identifying areas of improvement in reflective practice. So first of all, the purpose of using self-reflection or reflective journaling is to be able to enhance patient outcomes through this practice. The second is also to be able to attain excellent health care improvement. So at this point, our slides are going to teach us purposely how to unleash the power of self-reflection, and then how to identify areas that we can improve for better patient outcome. So I'm just giving you something to reflect on. This has got to do with business, but I hope that as healthcare professionals, you do see your work as a business formation as well. It says that a solid business foundation sets the stage for growth, innovation, and long-term sustainability. It involves defining clearer goals and objectives, creating a well-defined organizational structure, and implementing effective processes and systems. See, all this English, at the end of the day, when you do not reflect and think deeply about it, there is no way you'll be able to set up a good business model and run it successfully. So in our practice, wherever we may be, whether it is in the government sector, it's in the private sector, it is important that we see healthcare provision as a business. It's not a favor. And so you need to think broader. You need to plan ahead. You need to set goals and achieve them in order for this business you are into to improve and be better, and for you to be able to do much better for your patients. So reflection is a powerful tool, as we've known from the other key speakers. Reflection in healthcare provides and enhance patient outcomes. Practitioners who embrace the system of reflection seem to know better their strengths and their weaknesses, to improve and continuously enhance the style of their practice. We also know that in pursuing excellent healthcare practices, reflection is something that ultimately gives the patient a way to adjust and tell us exactly what our practice did on them. When you reflect to a certain point, you tend to be able to take a patient or a client through a reflective process very quickly without necessarily sitting down to journal or thinking or putting it down in all the methods of reflection. And by the patient helping you to self-reflect, you get to know exactly what your work did on that patient and what you can do to make the impact stronger and more excellent in the future. So what happens in self-reflection when it comes to healthcare? Reflection in general is self-assessment, and then critically, the word there is critically evaluating an action that you have taken in order to improve future actions. Now, reflection or practitioners that involve themselves in reflection tend to get knowledge, skill, change their attitude, and then see areas that they can improve on. Another benefit is self-awareness. We are aware that the more we know about this principle of self-awareness and then inculcate it in our practice, we tend to be able to solve problems per our abilities, be more focused, and increase patient satisfaction, because we know exactly what our limits, our limitations are, what our strengths are, and we are more targeted or focused in our practices. And so reflection is actually a culture, okay, of continuous learning and fostering of excellent healthcare delivery. So it's a culture you build. It is a process of continuously learning, and then it is something that helps you to continuously give better healthcare delivery systems. Reflection is also about self-consciousness and thinking, analyzing your own experience, what you did, what it did to you, the person, the structures that were shaking in your own body, in your mind, your psychology, your mentality, and everything. It reforms your experience. It makes you more self-aware, and then you adjust to be able to give your patients better. Okay, so what happens, or what are the benefits of reflecting or reflective practice in especially healthcare? It increases our patients' positive outcomes in several ways. It leads to improved quality assurance or quality healthcare provision. It improves learning processes. It improves professional development. It allows the professional to stay updated or advanced in their practices. And then it also improves empathy and patient-centered care, fostering deeper understanding of what the patient prefers or what will satisfy the patient's experience. How do you reflect? You can reflect in so many ways. One, you can use journals. You can use notes, pad and pen. You can use your computer, you can use your phone, you can use your iPad. You can also do mental reflection. You can do peer reflection, where you are seeking feedback from your own colleagues. You can do patient reflection, like I cited in the first instance, like trying to reflect together with the patient, how it made the patient feel, how it made you feel, engage each other, and then you would be able to come to a conclusion how the whole experience was like. You can also reflect through clinical supervision or mentorship. You can participate in case study or reviews and discussions. That is why we have in our systems mortality meeting, autopsies. We do have clinical meetings, we have team meetings, we have ward rounds. All these are systems of reflecting. So example, we had a ward round yesterday and we decided to put this patient on antibiotics. At the end of the day, how did that go in 24 hours? It is a team reflection. And when we all bring diverse views about why and how and what we put the patient on and the results, it improves or it makes us change our mind to a certain area instead of sticking all the way through to the end and then we realize that we do not achieve our aim. Reflection helps us to daily evaluate our patient's care. We can implement the understanding we get by First of all, knowing our strength, our limitation, making a decision to gain certain skill, and then ultimately this skill that we gain affects the way we practice, and it enhances our patient's outcome. Implementing reflective practice in healthcare. So in the healthcare organization, how do we create this culture of continuous learning and self-improvement in the form of reflective practice? What we do is, like I said earlier on, do peer discussion. You can do that. You can self-reflect, do peer discussion, mentor programs, or you can identify certain areas, sit down in a professional development area or space, and then discuss on a round table how to ultimately improve those outcomes, and then go for a better patient satisfaction. This leads to enhanced patient care, improve outcomes, and then the benefits, like we said, are plenty. It's a form of feedback seeking system. Simply, that is what it means. So an example is that in the hospital environment, when we have a suggestion box, we are actually looking for a reflection of how our system works, or how our practice has been. And that will be an evaluation of probably the entire hospital. What we are trying to show you today is that instead of having the general overview of what your clients or the public views an entire hospital, you want to know how they view you as a person. Number one, how do you yourself view your job? Or how do you think the job went? I did it like this, I could have done this better. I think I did this well, and next time I'll do it like that. These are the steps. Or you want to do a peer reflection by allowing your peers to judge you. You did it like this, you could have done it better like this, you did this very well, next time you can do it like that. Or you do the same to your peer as well, and then at the end of the day, the last one is allowing the patient to also tell you their experience. I felt like this when you did it this way. I think in this way I didn't feel good about it. I wish it was like this. This you did was excellent. I wish it is always like that. So this is how you go about it when it comes to the healthcare system. So how does it affect patient outcome? Number one, like I said earlier, case studies can be used as a self-reflection method, group reflection method, or a reflective method in general. So when you participate in case studies, they become a powerful tool for you yourself to think directly about the impact you've created on patient outcome. By examining yourself and scenarios that you performed professionally, you tend to realize that there are certain things that you need to improve on. There are certain things that you can keep hammering on, and at the end of the day, it shapes your professional care and give tangible improvement in patient care. Studies also have highlighted that effective self-reflection diagnoses accurately and provide personalized treatment planning, and give better communication between patients and families and care providers. What we mean by this is that when you have thought about it better, you realize that the issues you saw that led you to a particular diagnosis on A day, for instance, may change the next day after, because you tend to focus more on what the patient may prefer, the line of duty of that patient, the social background of that patient, the cultural background, religious background, and so it will tilt your treatment plan, and then it will help you to better communicate with the patient and their family, and you realize that probably the same treatment that you were given is now being given in another space or in another direction that affects the patient more positively than it would have prior to your self-reflection on how you have gone about your professional work. So incorporating reflective practices in healthcare has a significant impact, and we can give examples upon examples. So one example I can give is it goes all the way to the first time I started self-reflecting. This is way back in nursing training college, when I just woke up one day and then decided that whenever I perform a task, whether as a student or when I get on the ward during my clinicals or practicum, I would come back and then see how I performed that task. First of all, I will ask my supervisors how I did, what I could have done better. And I had good supervisors who would ask my mates to actually also say what they think about how I performed the task. These things made me start to think in bed when I am back from the ward. How did that go? Even if it was a dummy that we worked on, the practicum lecturer would give their results or what they observe, and then I would think about it when I am in bed. I didn't know how to journal it at the time, but I would think about it and know that I should have done it like this or like that. And then anytime I approach that particular task again, you realize that the practice is better, or how you go about the task improves somehow, even before we started doing it on actual human beings. And so if we keep reflecting, now that we are professionals, anytime we go home, so I saw patient at the end of the day, I prescribed or I was asked to do procedures on this patient, and this was the results after I did that. This is where maybe I did my best. This is where I didn't do too well and I can improve. It makes our practices better. One thing I want to put across is that in reflective practices, there is nothing as you had it wrong or you did it wrongly. If you did it wrongly, then it will be a different matter. It will be a negligence, or it will be your unprofessionalism, and that is actually criminal. So in reflective practice, you cannot say what I didn't do well, but rather where I can improve. So yes, they may be your weaknesses, but you are not looking at it as weaknesses. We tend to have significant impact. This is all we are saying. We tend to get more feedback and participate in case reviewing, identifying areas that will keep improving our services. This kind of practice also comes with challenges. Adopting reflective practices in healthcare organizations can present a lot of challenges. However, it is crucial that we unleash the power that is in us to overcome those challenges. Some of these challenges are the fact that we are resistant to change. because we have not always done it, that when I go home I will look at it again, how I have done my work today, and know where I can improve, where I did better, and how I'll do it tomorrow. And so we will tend to say things like, is it really necessary? It is a sign that we are being resistant to the change. We may say there is lack of time. I mean, I don't have the resources. We give excuses like, really, to pick a pen and paper or my computer. I don't even have a computer. Or in especially group reflection, or allowing a patient to co-reflect with you, we fear the judgment that may come, that we may not take the criticism so well. So in addressing these challenges, we do leadership support, training programs. Like I use the word here, I said they are not necessarily your weakness, or they are not necessarily something you did wrong, but however, they are areas you are identifying to improve. So using such language as leaders helps us to encourage our juniors to self-reflect or open up for group reflection, if that is what we choose to do. And we create a safer, non-judgmental environment for reflection. When we do all this, healthcare professionals can open up more for self-reflection or reflective practices, and it will unlock their full potential. Healthcare system is such that the more you practice, the better you become. And so looking back, picking on where you can improve, knowing what you did better, and planning ahead would always make you better and better. Other areas of improvement identified during reflective practices may need you to deploy strategies to address them. Yes, I thought about how I was asked to insert a catheter yesterday. At the end of the day, when I look at the fact that KY gel was not available for me to make the procedure comfortable for the patient, and so I had to use something else in order to improvise and then do the procedure. The only way to improve this problem I encountered in inserting the catheter is to address the system and approach my supervisors or the hospital management on the provision of KY gel, which is not in my capacity as the professional rendering the service. So you realize that the reflective practice has set you on a journey to want to confront the system. And people that tend to practice reflective journaling or do professional reflection tend to always have issues with systems that are set in place, because their thoughts will get them to play out to know where the systems faulted. It is not always that the issue is from the professional's practice or in finding the improvement areas. It's about the professional. It may be after confronting the system itself, and that brings a lot of challenges or a lot of problems, if you may call it, even in the collaboration with your other colleagues and the rest. The strategies may also include sort of education and training that you may not have your hand in it. You may need sponsorship in order to be able to get it. You may need permission in order to be able to get it. And so it makes it difficult and uncomfortable when you have identified that the problems that are inhibiting the improvement of your services are in areas that you yourself cannot do something about it. Some reflection also tells you that you may have to collaborate with your colleagues and in order to be able to improve. When you do not win their cooperation, collaboration becomes difficult. And like I said earlier, the moment you reflect and then you know the problem and you know the solution to go for, and then you cannot go for the solution, it becomes quite difficult for you, the one that did the reflection. Also, implementing evidence-based practices. You have practiced and you have realized that when you do it like this, it is like that. And so you will wish that you change the way of doing things. This is based on what? The evidence you have on your practice. Now, implementing that without policy support, without system support, becomes difficult for you. Reflection also involves technology. It involves innovation. And it is not all the time that we have the resources to be able to go about this. Actively seeking feedback from patients and families can also be challenging. We all know that not everybody looks at being constructive at their criticisms or being focused on getting you to improve. Some people criticize to damage. And so when you are continuously opening your practice for other people to give feedback, you also need to do that with caution, knowing that people may use the chance to hurt, even among colleagues. So in effect, we are saying that reflective practices in healthcare has challenges, but the challenges, we work through the challenges. Okay, we work to make, though there are challenges, we work to make sure that at the end of the day we rise above those challenges and we take it day by day and ensure that our practicing is changing and improving day by day as well. Evaluating reflective practices. It's important that you evaluate, especially for those who journal it. And I must say that it's important that you journal it. It is interesting when you go back years after and then you look at what you have journaled in year 1 and how far you have come 3 years after. So try to evaluate. Go back and read your journal. That is a form of evaluation. Or when we sit down to judge on the feedback we had, that is a form of evaluation. So evaluation is a way that the system or the healthcare organization further justify and integrate the support of the reflective practices that have collectively been taken among their staff. So Mr. Osimesi found out that using a silicone catheter is better than using other materials used for catheter. Mrs. Osimesi also found out that using this brand of gloves serves the healthcare workers better than using that kind of gloves. So when we sit down on the round table to maybe do an audit service, or we are doing a procurement meeting, and then we have all the unit heads or we have representatives from the unit deciding on which brand of material and that to buy, we are actually evaluating what our individual professionals reflected in their homes. When I use the glove, at the end of the day, this was the effect. It is registered in my mind. So when I had the opportunity to sit as a unit representative on the procurement committee for a quarter, I brought it forth that this brand of gloves had this effect on me, and probably Mr. Osimesi I work with also complained of the same thing, and so collectively putting our experiences together, the hospital decides not to go for that brand. That's how we make use, or we evaluate our collective reflection and then use it to support our practices. Also, there may be various barriers and constraints when it comes to evaluating it, because we are afraid, especially of the system. Okay, how dare I go talk about the gloves they went to buy or the sanitizer they went to buy that I reacted to it, because at the end of the day the procurement manager may have problems with me, or I suspect that the procurement manager has a cut to deal with where they purchased the sanitizer, and so going to talk about it brings an issue. So I'll prefer to keep quiet rather. It doesn't help proper evaluation of our reflective practices. It doesn't make us make use of this all important and essential individual practices we have done in our rooms, and at the end of the day it will inhibit the improvement of healthcare and our practice improvement as professionals as well. What is the future when it comes to reflective practices? I have mentioned already that digitalization or technology and innovation is affecting the horizon when it comes to reflective practices, and so the future looks bright. We are looking at means where we move from more criticisms at mortality meetings and rather looking at improvements. So I've been to a lot of mortality meetings where you realize that doctors are attacking nurses, nurses are blaming the house officers are blaming the pharmacists, and a whole lot of things, because all we professionals meeting there are not seeing that together our experience in our various fields is supposed to improve how we practice at the mortality meeting. And so the future of reflective practice is a space where we all understand that we are a team and we network together. The experience and the work of the nurse is not the same as the doctor. The work of the doctor is not the same as the pharmacist, but collectively we form the team that gives the patient the right or the improved services that they are paying for. So I need to respect the nurse's view, and the nurse needs to respect the cleaner's view. I wish we had a system, and I see the future, that we are going where now ward rounds will not be doctors' ward rounds, but will be team ward rounds, having everybody from nutritionists to physiotherapists to everybody on board, bringing various contributions. What can help? I have been in areas of practice where a physiotherapist will tell you, well, if this patient is not breathing well, instead of continuously putting the patient on oxygen, that is one, expensive, and then two is keeping the patient from being discharged. Why don't we try chest therapy so that the patient starts learning how to breathe on their own? And it did work after some days of chest therapy. But when the physiotherapist has been isolated in the team discussion and decision making of the treatment plan, this suggestion will not come forth. And so you have your patient now oxygen dependent. The patient cannot be discharged home. If the patient has to be discharged, it means family have to spend a lot of money in order to go and find oxygen supply at home, and a whole lot of inconveniences. So the diverse professional views is something that we are looking at in the future of reflective practice. practices. We are looking at a future where we have our peer review system being about reflective practices. Peer review in Ghana has become like, oh, let me put this here. Like, people do have gadget equipment and the rest that they hide until peer review time, and then they bring it on board and display it. It's not there for work. We wish that we get to the point, and it is getting there. It is done elsewhere. It will happen in Ghana, where people come to work with their journals as diaries. They have they use peer review as a time to reflect and do better. They are actively interested in feedback. People are interested in mentorship program. We call it precepting in Ghana. And it is important that as an in charge, you have in your unit people that you are precepting. There is a possibility that people that you are precepting may not necessarily be under you, but somehow the way and manner you go about your practice affect them in a way that they want to practice like you, and so you are precepting them from afar. What is important is that you are making a positive impact on other younger professionals that are coming back, and that is okay. So we are looking at reflective practice in all these areas. We are looking at sharing reflective practices in online platforms and sharing the knowledge and collaborating for better. We are looking at reflective practice in service audit, like maternity units are sitting down to look at the service of antenatal and postnatal and the natal room, what is happening there, how many patients we lost, how many babies we lost, how many bled out, and all that happened. Then we can be able to evaluate for better outcomes. So this is how the future actually looks. Next slide. So in conclusion, we say that the power of self-reflection is to significantly impact on patient outcome in healthcare. It is by encouraging healthcare professionals to engage in self-reflection, peer reflection, group reflection, patient, staff, or professional reflection, and participate in meetings that audit our services. We need to also integrate technology, collaboration among healthcare professionals. We need to look at our peer review system and make sure that it is improving our practices. And we need to be able to target satisfying patients, what patients seek, and ensure safety and overall quality in healthcare delivery. Reflective practice has the potential to revolutionize healthcare and enable professionals to continuously identify opportunities for improvement. Technology advances, online platforms are opening, forums are opening, and they will play a crucial role in making reflective practices or facilitating knowledge and sharing and collaboration better to drive the positive change that we are all looking at. I hope you enjoyed this session, and I hope we get the platform where we can reflect. I am not very used to giving assignments, but what I will tell you is that from now till we meet again next year, have something written every day, anytime you go and practice at the hospital, on the field, at people's homes, wherever you are having your healthcare practice. See ya.